Okay, guys, welcome back to class as we continue to work through and look at these five basic examples of anxiety disorders. And again, in this family of mental health conditions in the DSM-5, there really are several different diagnoses and disorders in this family. But we're just going to cover and talk about five that really are much more common than the others. And I just want you to be familiar with as we kind of go through and think about anxiety, as we think about stress and fear and worry and all of those emotional experiences that kind of fit with this thing called an anxiety disorder. So we've already talked about the first one, what we call a specific phobia, which again is just a real quick review. The term specific phobia is a very, very broad diagnosis, very broad term under which any number of different intense, out of proportion fears can fall. And there's all kinds of different phobias out there in our world today, all kinds of different theories as to what causes them, and et cetera, et cetera. But for this class, I want you just to kind of grab onto just kind of that idea that the term specific phobia is the term that we use to describe that common experience related to being afraid of something. Now, actually, there are three different phobias that we're going to talk about in this section because three of the five different disorders that we're going to talk about in this section really are phobias. The first one we've already done, that's specific phobia. And then there's here something called agoraphobia, which we're going to talk about in just a little bit. But then there's also this one I want to review with you right now called social anxiety disorder, which used to be called social phobia. And so this is a phobia, although now we call it something else. We call it social anxiety disorder. But social anxiety disorder is a phobia. It is a fear. It is not only a fear, it is a marked and persistent fear that is outside of the realm of typical, that produces immediate anxiety or fear anytime a person thinks about or is exposed to a certain situation. It is a fear that someone actively avoid. Because of the fear, the person actively avoids or stressfully endures the situation. It is chronic and persistent. It causes some level of disruption. Well, this one's pretty easy. Sometimes you'll hear the term like agoraphobia, and you say, well, what is that? I mean, I see the word phobia, but what is agoraphobia? It's hard to kind of understand sometimes what that is a fear of, and we'll talk about that here in a little bit. But social anxiety disorder is pretty clear. Social anxiety disorder is a phobia of social situations, and it is a commonly experienced mental health condition that we see in our world today. Now, social anxiety disorder has been around for years and years and years. It is not a new diagnosis, but interestingly, we are seeing it diagnosed more and more in the last generation. Kind of the theory is that as we become more technologically advanced, we become more disconnected, unfortunately. And what happens is we're seeing, especially in those today in our generation under the age of 30, 35 and 30, we're seeing lots of people in that age group with what we call social anxiety and social awkwardness. Now, we believe a lot of that is because of the technology that we have, unfortunately. In previous days when we did not have the technology that we had, those of us of a certain age, we were kind of conditioned at an early age and forced to socialize. And we had to depend upon our social skills in order to survive. Well, today, people can fully function in the world with very few social skills because of technology. That has not always been true. There was a time where you did not survive in the world unless you knew how to socially interact and navigate social interactions with people. And because of our technology, that's just not as needed anymore. And so what we believe is happening is we're seeing more and more people with what we call social awkwardness and social anxiety. Let me make a couple of distinctions. So social awkwardness or social uncomfortableness is not a diagnosis. There's a lot of people who are more private and more withdrawn, and they don't really like attention being drawn to themselves, and they don't really like social situations. They kind of like to stay to themselves. They're kind of reclusive a little bit, and you got a little bit of that in them. And so, but they can socialize, and they're able to when they're able to. They just don't like to. They're able to, but they just don't like. That's called social awkwardness or social uncomfortableness. That's not social anxiety disorder. Social anxiety disorder has the word disorder in it. And so social anxiety disorder is where a person on an emotional and physical level and psychological level, it is almost impossible for them to interact with people because of their fear and their anxiety. Social anxiety disorder is a marked and persistent fear or phobia of social situations, especially when they involve strangers. And so that is what it is. What it is. Let me highlight a couple of things with social anxiety disorder. In a way, it's a very complicated, complex disorder, but it's got a pretty basic definition. Um, this is a social anxiety disorder is characterized by a fear of two or more situations where social interaction is required. So, someone with social anxiety disorder would not just be afraid of school, but then go to work and do fine. I mean, they wouldn't be just afraid of work, but then they go to church or go to school, no problem. That's not what social anxiety disorder. Social anxiety disorder is where that fear of social interaction, that anxiety and paralysis around social interaction is present in multiple situations: work, church, school, even family sometimes too. So two or more situations is important. Also, too, the idea with social anxiety disorder, let's kind of get a little bit deeper. People with social anxiety disorder are especially fearful of situations where they are going to be exposed to what the DSM-5 calls scrutiny by other people. Now, the term scrutiny often has a negative connotation. The term in this context is a very neutral term. The term scrutiny just means where I'm going to be observed and where I have to interact with other people. So scrutiny just means being in the presence of other people to where they will see me and where I will see them. Social anxiety disorder also too is especially a fear where a person avoids situations where they'll have to, I'm going to put my air quotes up here, where they have to perform. Now, perform means this. It can be, at its most basic definition, a situation where getting up in front of people to give a speech. That would be performance. And so people with social anxiety disorder are going to be really nervous and try to avoid about those kind of situations, performance situations where I have to give a speech. But performance could also be going out to eat with a group of people where there's an expectation that I'm supposed to be a part of the conversation. That's also would be considered performing. Performing could also be something like this. I have to work on a group project with some classmates. And so there's an expectation here that I have to work with you guys and interact with you guys, and I have to help give the presentation. That's a part of performance. Performance could also be holding a job like in a restaurant where I have to wait on people, or like in a department store where I have to wait on people, or where I'm working like a volunteer booth and people are coming and asking me questions. And there's an expectation that I'm supposed to not only interact with you, but I'm supposed to perform a behavior in front of you and help you. That is all under the heading of performance, according to the DSM-5. So people with social anxiety disorder are going to really struggle with those kinds of situations. I also give you in your lecture notes and in the PowerPoint presentation an easy way to think about social anxiety disorder is just to remember the two key preoccupations. What we call, when we say preoccupation, what we mean is that these are the two things that people with social anxiety disorder are really afraid of. Here's really at the base level, at the core of the fear. Here's really what people fear with social anxiety disorder. Number one, they fear that when they're in front of other people, that they're going to do or say something to draw negative attention to themselves. They're going to do or say something embarrassing. They're going to do or say something where people are going to notice them. And so that's one of the core preoccupations and struggles with social anxiety disorder is I'm going to do or say something and people are going to look at me. I'm going to draw attention to myself, especially negative attention. That's one of the real fears with social anxiety disorder. The second preoccupation is kind of related to that, but this idea that people with social anxiety disorder oftentimes are over concerned, they're over focused upon, they're preoccupied that people are going to negatively view and judge me. And now all of us want to be accepted by other people around us. I think most of us, none of us wants to be rejected. I don't think any of us really wants to be rejected by other people. But people with social anxiety disorder, that really is kind of a core, predominant preoccupation. They have this, it's almost kind of a self-esteem, personal insecurity kind of a thing. And a lot of their fear is, what if people not only look at me and notice me, what if they view me negatively? What if they reject me? What if they think I'm stupid? What if they think that I don't know what I'm talking about? Well, most of us struggle with some of that, but most of us, if you don't have social anxiety disorder, most of us kind of navigate that and we just kind of, just do our best. And if we make a mistake, well, then we make a mistake. Well, people with social anxiety disorder are preoccupied and terrified. If I use the word terrified, they're terrified that they're going to do something say something that sounds stupid or dumb, and people are going to look at them and say, well, he or she doesn't know, look at them, right? So this idea of drawing attention to my doing or saying something embarrassing to draw attention to myself. People with social anxiety disorder do not want attention on them, right? Number one. And then number two, this preoccupation with negative attention, or being rejected, not being accepted, and being rejected by people inappropriately. So those two core kind of preoccupations are really, really important to keep in mind when we think about social anxiety disorder. So again, social anxiety disorder is a commonly experienced and commonly diagnosed mental health condition. It is grounded upon and focused upon this idea of social interaction with other people. And again, these two core preoccupations, and again, it is a phobia. That's the other important piece to kind of keep in mind, is that it is a phobia, fits in that category of phobia. So be familiar with social anxiety disorder. So that's the second disorder we want to talk about in this section. Specific phobias is the first. Social anxiety disorder or social phobia is the second. Here is the third, and it is called panic disorder. So let me ask you this question. Have you ever experienced what you would consider to be a panic or an anxiety attack? When I usually ask that question in class, I usually have lots of people who raise their hands and say, yeah. Anxiety or panic attacks are really actually not that uncommon. Many, many people have experienced them. And many people in our world have experienced just one or two of them, and they don't have them consistently, right? But an anxiety or a panic attack is something that is important to be familiar with. Because again, it is something that we see in many different mental health conditions. A panic attack is a distinct, sudden onset of intense fear or terror. A panic attack has a lot of the symptoms of a heart attack. And panic attacks have a lot of physical symptoms. People feel tightness in their chest. They feel shortness of breath, heart palpitations. Their hands and feet will tingle. They'll feel faint. They may feel a sense of choking or smothering, hard to kind of catch my breath. It's got some physical kind of symptoms, and usually those symptoms in a panic attack come on very, very quickly. There's usually a quick onset of symptoms. Panic attacks also have a lot of cognitive or emotional symptoms. People's thoughts begin to race. They begin to feel afraid and threatened. They feel like they got to get out of a room or get out of a situation for no reason. They may feel like they're going crazy. They may feel, again, like someone's coming to harm them, or they've got to get out of a situation. They may also to experience what we call derealization or depersonalization. Derealization is where where while I'm having a panic attack, the room starts to kind of get wavy. Or maybe if I'm walking down the hallway here at the college and I have a panic attack, I may have this visual experience or perception that the hallway is kind of wavy, right? Or maybe the experience that the walls are closing in or the ceiling's closing in on me. That's called derealization. Depersonalization is another similar symptom. Maybe when in a panic attack, a person may have the experience that they're outside of themselves, looking back on themselves, or that the panic attack is happening to someone else and not to them, almost like they're like an objective observer to them. That's called depersonalization. So there's all these different symptoms of a panic attack. I list several of them for you in your lecture notes. Your DSM lists several of them as well too. Panic attacks are very, very interesting. They're also very, very scary. And so if you've never had one, again, if you work in the field of social services, you will work with people who will describe to you, or maybe even while you're talking to them. I've had that experience happen to me many times, where while you're talking to them, they have an episode of what we call a panic attack. It's very scary for the person, and oftentimes very hard to understand, and oftentimes very hard to kind of control. And so panic attacks are not uncommon experiences. People who battle depression can have panic attacks. People who have post-traumatic stress disorder, or OCD, can experience panic attacks. People who have phobias can experience panic attacks. But what about this situation? Can you imagine being a person who is driving down the freeway one day and out of the blue you have a panic attack? You don't sure why you have one. You aren't going through something real stressful. You just have a panic attack. You have this real quick onset of fear. You may feel like at first you're having a heart attack. Maybe you got to pull over to the side of the road. And maybe at first, if you don't know what's happening, you may call 911 and go to the emergency room thinking that you're having a heart attack. That's not uncommon at all. A lot of people wind up in the emergency room having panic attacks, thinking that they're having heart attacks. And then let's say hypothetically, you go to the emergency room and the doctor says, no, you're fine. You're good. Your heart's fine. You're just having more like an anxiety kind of a thing. And you go, okay. And you may rationalize in your mind thinking, well, I'm going through a lot right now. And so it's just kind of a one-time thing. Imagine that later that night, you have another one at home. You're laying in bed and you're already asleep and it wakes you up out of sleep. You have another panic attack. So you have like two, like in the period of like 6 or 8 hours. And then maybe you go another couple of days and you don't have another one. And then one morning you're getting ready to come to class, you're fixing breakfast and you have another one just out of the blue. Not sure why they're happening, unpredictable, unexplained, out of the blue. You go to your doctor checks you out and says you're totally fine. This is more of a psychological, emotional kind of thing you're going through. Well, the diagnosis called panic disorder is that is what I just described to you. Panic disorder is a diagnosis where a person experiences recurring patterns of unexpected and unexplained, two key words, panic attacks. And there are people out there who that is what they struggle with. Now, panic attacks can be kind of brought on by stress. They can be brought on by lack of sleep and those kinds of things. But really, the idea with a panic attack, we think a panic attack is just an emotional expression of just someone's anxiety. We're not always sure why people experience panic attacks because panic attacks have two different forms. And I give this to you in your lecture notes. Generally, there are two general types of panic attacks. We call cued and uncued. And the word cued is C-U-E-D, cued. A cued panic attack is one that's triggered because some people have panic attacks that are triggered. Now, the examples I just gave to you a minute ago, those are not examples of cued panic attacks. But imagine that you have like a really strong, we talked in the last video about about specific phobias. So imagine you had like a really, really intense fear of like snakes. And you're out in your backyard walking around one day, and just out of the blue, you experience here's a big old snake. I don't want to freak you out, but there's a snake in your backyard. And you might trip and fall, and it might startle you so intensely as you try to get away that you might have a panic attack, a mild panic attack or a severe panic attack. Just a second ago, we talked about social anxiety disorder 3 or 4 semesters ago, right here on our campus. I had a student who actually is about to graduate from our program. And she told me this. She said, Professor Killian, my social anxiety was so intense that the first 2 weeks I came to class, I could not get out of my car. I had a panic attack in my car on the parking lot every time I came for the first 2 weeks because the idea of having to get onto the campus around all these strange people tripped and freaked me out. Well, so her panic attack was not out of the blue. Her panic attack was directly connected to her fear. She had a fear. Her fear was social anxiety disorder. So we would call her panic attack cued or triggered. It is the panic attack is always preceded by having to face something I'm afraid of. In her case, social anxiety disorder. So that's one general form of panic attacks, a cued or triggered panic attack. That's not panic disorder. Panic disorder is when people have the unexpected, out of the blue, I'm not sure why they're happening panic attacks, because those can also occur too. And that is why the words unexpected, unexplained are really important with panic disorder. Okay. So, panic disorder is a mental health condition that is characterized by unexpected and unexplained, persistent and consistent panic attacks. So, when panic attacks occur out of the blue, we don't know why they're happening. That is called panic disorder. So just a little clinical kind of guidance here. If you're ever working and doing counseling or doing an intake with someone and they begin to explain about they're having panic attacks, you always want to get a little deeper into number one, what do they mean when they say panic attacks? I've had clients before say, yeah, I always have a bunch of panic attacks. I always want to make sure I understand that I know what they mean when they say panic attacks. If it sounds like, in fact, yes, they are having an anxiety or a panic attack, then I always want to find out, well, how often are you having them? And let me ask you about the last 3 or 4 that you've had. Has there been anything that has brought them on? So tell me about when you have, this is a real simple way to ask. Tell me about when you have panic attacks. And so you're trying to kind of get down to, is this a triggered panic attack or untriggered, cued, uncued? And so oftentimes people will say, well, you know what? I'm a military veteran and I have some PTSD symptoms. And so anytime I hear fireworks or loud noises, I have a panic attack. That's called a triggered panic attack. That's not panic disorder. What you're listening for with panic disorder is someone who says, I don't know why I have them. The first one I had 3 or 4 weeks ago, I was driving down the road and I had one. It woke me up out of sleep, and I went a couple of days, didn't have one. And then I was getting ready for class one morning, had one. And then I was in the restroom at the college, going to the restroom, had another one. They're kind of out of the blue, not sure why they're happening. That is called panic disorder. Okay, so the key idea with panic disorder, it's not just panic attacks. It is unexpected, unexplained panic attacks. Now, here's the key thing with panic disorder, and we'll be done with panic disorder. If you look in the definition in your lecture notes, and if you also look in the definition of the DSM-5 of panic disorder starts with unexpected, unexplained panic attacks. That's the first core symptom. The second core symptom is this, and this is really, really important. And this is this kind of makes sense though. Panic disorder is also a disorder where not only is someone having unexpected, unexplained panic attacks, but as a result of those attacks, the person begins to worry about having another one. That's why we call it an anxiety disorder. And by the way, it would be very natural. If you have ever had unexpected, unexplained panic attacks, you know that it's just natural for us to begin to worry about, well, what is going on inside of me? When's the next one going to happen? So panic disorder is characterized by unexpected, unexplained panic attacks, followed by the worry of having another one, or worry about what does this mean? What is going on within me? Feeling or worried that I'm going crazy. And then secondly, as a result of my panic attacks, I begin to change my behavior patterns significantly. So maybe I don't go to class anymore. If I've had a panic attack the last 2 days, maybe I don't want to go and have one at school. So I email Professor Killian and say, I can't come to class today. Maybe I don't go to work. Maybe I don't drive on the freeway. Maybe I just decide to stay at home for a few days because I don't know what's going on. And by the way, that is very natural. That would be a very natural coping mechanism. So panic disorder is characterized not just by the unexpected, unexplained panic attacks, but also too by the cognitive emotional worry. When is the next one going to happen? What's going on to me? What's going on with me? Number one. And then number two, some level of behavior, significant behavior change is disruptive, to where I start to change my behavior patterns as a result of the attacks. I begin to change my behavior patterns as a result. So panic disorder is not just the panic attacks, it's also the cognitive emotional worry about having another one and what do the attacks mean, and also the behavioral change as well too. So in this little video, we've talked about social anxiety disorder or social phobia, and we've talked about panic disorder. Again, both of these disorders, they kind of are what they say they are. Social anxiety disorder is a disorder where people have intense fears and anxiety around social situations. Panic disorder is a diagnosis or a disorder where people experience panic attacks. Now, it's not called panic attack disorder. It's just called panic disorder. Panic disorder is where it's a mental health condition where people have unexpected, unexplained, out of the blue, not sure why they're happening, panic attacks. That's a key idea with panic disorder. So there are 3 general anxiety disorders: specific phobia, social anxiety disorder, panic disorder. We got 2 more to talk about: agoraphobia and generalized anxiety disorder. Come back and look at the next video, look at your lecture notes and the PowerPoint, and I'll see you next time.